Hello, my name is Preston Peterson, and I'm your March of Dimes NICU Family Support Coordinator at Spartanburg Medical Center. Thank you for taking the time to view our virtual NICU Intensive Care Unit, or NICU, tour. In addition to supporting NICU families, I also care for babies in the NICU as a registered nurse. Come with me as we talk about guidelines to protect the well-being of your baby and what you can expect in the NICU. For the safety of all infants, families, and staff, the NICU is a locked unit, meaning entry into the NICU is strictly controlled by keeping the doors locked and video monitored. Other than essential approved staff, parents and legal guardians are the only people allowed inside the patient area. The NICU is treated like an operating room. To ensure our babies have limited access to additional bacteria and illness, food is not allowed in the NICU. Drinks are allowed, but they must be in a sealed container. Sleeping while holding your baby at any time is dangerous, but it is strictly prohibited in the NICU. Excess noise in the NICU can be physically harmful for our babies. Alarms and equipment sounds are noises that cannot be avoided, but additional sources should be controlled, such as ringers or alarms on phones or other electronic devices. Please silence those before entering the NICU. Telephone or FaceTime calls. Please make sure to take any calls in the main lobby. Talking to one another. Conversations should be held in a hushed tone. Watching videos or listening to music. Keep volume at the very minimum, or better yet, use earbuds. Tapping on baby's bed. Please do not tap on baby's bed and be mindful of closing drawers and doors on equipment. Accurate passing of information about the care of your baby happens between 6:30 and 8 a.m. or 6:30 and 8 p.m. That's when the NICU staff changes shifts. No entries or calls into the NICU are allowed during this time to limit distractions. To gain access to your baby's bedside area, pick up the red telephone in the NICU lobby. When someone answers, tell them your full legal name and your baby's legal first and last name, which will be the same as mom's legal last name. We may have more than one baby by the same first or last name, so please remember to tell us both. When you enter the NICU lobby, before using the red telephone, please use the lockers we have available to store those items that aren't allowed inside. Again, no food or open drinks or clothing that has been smoked in is allowed inside the infant area. Choose a locker with the key attached, place items inside, put a coin from the pail hanging beside the lockers in the slot on back of the lock, that's needed to remove the key, and close the door, locking it with the key, and remove the key. When your visit is over, remove your items and leave the key in the locker for the next family to use. Now you can use the red telephone to be allowed inside the hand washing area. Once you're allowed access through the locked door, the first thing you will see is the hand washing station. Newborns, especially those who are born early, can easily get sick from germs brought into the NICU. Each person that enters the NICU, including all staff and visitors, must scrub their hands and arms up to their elbows for 2 minutes with the surgical scrub brush provided above the sink. Prior to washing, please remove all jewelry and put in your pocket or purse until you leave the NICU following your visit. Please follow the video above the sink closely to ensure your hands and arms are clean. Kangaroo care, or skin to skin as it's sometimes called, is putting your diapered baby on your bare chest. It's important for babies to use their energy and nutrition for development and growth instead of crying, making heat, and moving. That's why it is important to keep them calm and warm. Kangaroo care may help your baby stay warm, keep their heart and breathing regulated, gain weight, spend more time in deep sleep, spend more time being quiet and less time crying when they're awake, and have a better chance of breastfeeding. And kangaroo care isn't just for mom, it's for both parents. Why is touch important? Babies, just like adults, need contact with others. Touch can help calm your baby, contribute to bonding, and simply let your baby know they're not alone. When touching your baby, remember that our goal is not to stimulate them, but to calm them. Use gentle, still touch. Use hand hugs, which is placing light pressure on your baby's head with one hand and your other hand cupping their feet or on their tummy. Do not pat or stroke your baby. A firm, gentle touch is best. There are many ways to participate in your baby's care while in the NICU. Reading to your baby, changing diapers, feeding them, especially breastfeeding, pumping breast milk, checking temperatures, and asking questions. Some examples of questions might be, what does the equipment being used do for my baby? What medicines are my baby receiving and what are they for? Where can I get emotional support? Where can I wash my breast pump parts or bottles? Can I hold my baby? The most common question parents have is, when will my baby be able to go home? There are milestones that babies must meet before discharge. Certain health challenges or diagnoses may lengthen your baby's stay. Some of the milestones for discharge could be things such as your baby needs to be at least 35 weeks gestational age or more, weigh at least 4 pounds, have no need for respiratory support, have to have had no adverse respiratory or cardiac events for 7 days, had no weight loss for 5 days, be able to control their temperature without the use of artificial assistance, and be able to eat from the bottle or breast reliably and consistently without the use of a tube or pump. We know the prospect of going home with your new baby can be a stressful event. Our NICU offers a transition to home room where parents can have a trial run of sorts while still having nurses and doctors available for questions and assistance. As part of the discharge process, parents are asked to attend the NICU discharge class. During this class, we'll talk about topics such as safe sleep, feeding, bathing, diapering, infant CPR, and ensuring your baby's overall well-being. There will be an opportunity to ask questions and time to speak with other parents who are experiencing a similar journey. We have partnered with the March of Dimes to offer resources to help you through your NICU journey and following your discharge home. The Compass app is a valuable source of information and includes tracking tools that help document your baby's progress. Along with journals and trackers, the app includes a list of questions you may not think to ask your nurses or doctors. It also includes a glossary of terms to help you understand words that aren't familiar, and a postpartum checkup review with questions. The app is a trusted source of information and links to questions you may have about your baby. Remember, our staff is always here for your questions and concerns during your NICU journey. Thank you for spending time learning about the Spartanburg Medical Center NICU experience.